and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about infrapatellar tendonitis pain. We're going to relieve pain for Jerica.
Yes. And, for those who don't know, that means knee pain. Knee right by the kneecap or just below the kneecap. Typically,
Jerica means knee pain?
Oh, Bob. Why, Bob? Why? Jerica is a lovely young lady. She goes to MSOE, Milwaukee School of Engineering, and she's a track star. She's a long jumper, and she's going to be going to nationals.
So you were talking about infrapatellar before I so rudely interrupted you. So what you're describing what infrapatellar means?
Right, knee pain.
Knee pain
Right.
Below the kneecap, basically.
Right, exactly.
Infra means below, so
Right.
there's a kneecap. It's right below the kneecap.
We're going to get into that more
Okay,
detail.
good. If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on our social media platforms. We're always giving away stuff almost every day. We got some contests going on. If you go over to Bob and Brad on Facebook or Bob and Brad, our website, right now we're giving away the breather, correct? Yeah, we're giving away the breather. This is a great device for people who have COPD, asthma, sleep apnea, a lot of the respiratory problems. So, okay.
Okay, Bob. Shall we get into it now?
Yeah.
Again, with infrapatellar tendonitis, we're looking at the location. It's just below the kneecap. Okay, and there's a tendon there that, and if you don't know, the quadriceps, 4 large muscles on the leg right here, all 4 of them come together and connect to the patella or the kneecap. And then from the kneecap, there's one tendon, which is the one we're talking about, the infrapatellar tendon, goes from there to your tibia. So this much patella has to accept all the forces produced by these 4 large muscles.
Yeah, so that tendon alone has to accept all the forces.
Right. I didn't say that.
You said something weird, but anyway, so yeah, that tendon's got a lot of stress on it.
Right, it does, and particularly people who are running, going up and down hills, stressful things, jumping.
I think it's called jumper's knee even.
Sure.
It's just really common that you'll see it, and especially people who jump off the same leg each time.
Right.
I mean, that's going to obviously stress that leg more than if it was spread out.
Which is exactly the case in long jumpers,
exactly.
or Jerica's case. And typically the pain is right on the bottom side of the kneecap where the tendon connects to the bone.
So right below, right onto the underside right here of the kneecap.
Yep. And if you look at your own knee, and it's nice to do this in the seated position and with your quadriceps completely relaxed so you can move your kneecap a little bit. And then you can feel that tendon is right there. And I can feel, now if I tighten up, it becomes you can feel it become very taut and hard. And then if you relax, it becomes relaxed. So, and it's right there along that bone. So one thing you can do is if it's really flared up and irritated so that it's painful when you walk, usually it hurts more going up and down steps or with running, sprinting, those more aggressive things. You need to avoid doing what irritates it. Which, some people may be able to do it, but if you're in a sport and there's a big event coming up or for a job and you need to go to work to make money, you can't can't just stop, unless you absolutely have to.
It's very difficult and frustrating for an athlete to have to stop because of this, but, a lot of times it's not going to get any better.
Right.
So you need to calm it down.
Right.
So
if you are dealing with this, like in Jerica's case, I talked to her. She was putting ice on it, and I talked to her about
an ice pack?
Yep. So if you got a big ice pack like this to wrap it around. Now, the thing about this is it's going to cool down the involved area, but it's going to cool down the whole knee, which is no big deal. It works fine. You're going to hold that on there for 20 minutes or, not necessarily hold it, but wrap it up with your elastic bandage or whatever.
Always be a little careful right over the kneecap itself because there's really not much tissue there.
Yep.
So sometimes we even put a little washcloth or something or a paper towel over the kneecap itself.
To insulate it.
Yeah, to insulate it.
Yep.
So.
And, this has some cloth on it, but it may not be enough. One thing you can do to speed up the cold pack is take a cup, fill it about 3/4 full, and throw it in the freezer overnight. And then you have a
a block of ice.
A block of ice, yeah. And you're going to put direct ice. Now, with direct ice, you don't have to worry about frostbite to the skin because they have the water barrier and it gets cold really quick. And then, you
rip off the top.
Yeah, you rip off the edges of this so that just the ice is in
now
contact.
You can take my palm and smooth it out a little bit.
Yeah.
And then put it on.
Right.
So.
If you don't do that, it smoothens out. It's just a little uncomfortable that first 30 seconds.
Yeah.
But then you can put the ice directly on, and typically in 5 minutes is all you really need.
Yeah, it goes fast.
Right.
I mean, it's a lot more efficient than a regular ice pack.
Right. It's a little messy because you got water dripping down,
sure.
but a towel takes care of that. Now, the next thing, and this is one thing that I think Jerica, I'm going to try and get her this knee strap. This is a Mueller knee strap. There's other companies that make Chopat, and you can actually make one out of tape.
Sure.
Athletic tape. I would use something else. I think my mic is coming off my ear.
So Chopat is CHOPAT.
Okay.
If you look that up, and there's they have a lot of different variations of their braces.
And you'll see, like in this one, there's
like a silicone almost, right?
Right. It's a round tubular, like a cord or silicone. It's soft but firm.
Right.
Okay. And that is going to go right over that soft spot of that tendon between the two bones. And what it's going to do is I'm going to put it around here, and you can see it's stretchy. It's Velcro. And I'm going to put it around there with my knee slightly bent, and I'm going to tighten it up.
You tighten it up quite tight.
Yeah.
Right. Almost probably as much as you can tolerate.
Yeah, and you have to use some judgment on that. You're going to tighten it up for the event. You're not going to wear it like this all day long.
Right.
When you're going to stress it is when you want to tighten it up. In her case, for the long jump, she'll tighten it up and then take it off. And the idea is that pressure over that tendon spreads out the forces, so it's not just on the inflamed sore area. It spreads it out to where it's healthy and makes it more tolerable and doesn't re-irritate it to make the problem last forever or seemingly forever. So this is a really good, and they're not that expensive.
Right.
$10 or $15.
Exactly.
Not guaranteed to work.
Yeah.
But it's worth a try, particularly in these situations.
Right.
Did we want to talk a little bit about cross-friction massage?
I would.
Rob?
I would. I think a lot of times what happens, after there's actually micro tears that occur in the tendon.
Yep.
And they start to heal, and then you get scar tissue.
Yep.
And the scar tissue is kind of erratic. And so what you can do is, Brad, I don't know if you want to show, you go ahead, and you're going to do cross fiber massage. And you're going to go across the fibers.
Yep.
And what you're doing, two things. One, you're getting hyperemia, which means you're getting more blood flow to the area, which helps it heal faster. And the second thing, it breaks up that scar tissue. And hopefully it's going to heal stronger as opposed to scar tissue, which is kind of weak and it actually can break apart easier. So what happens, quite often people find out like, oh, it's getting better, and then all of a sudden they do something that's back, it hurts again.
Yeah.
And that's because the scar tissue broke open.
Sure.
So if you keep doing the massage and it heals in a lengthened, strengthened position,
sure, then
hopefully when you do a jump or something like that, it doesn't break open and you don't restart the cycle of pain again.
The exact recipe or the how to perform this massage is the fibers go this way. It's called a cross friction massage. You're going to go this direction. You're going to push in deep, and it's going to be a little painful at first. Now, when I do this, I look at a clock and I see how long I'm doing this. Now, if I continue to do this and after 30 seconds of this aggressive massage, if the pain is not starting to reduce or it starts to feel like a numbish, better feeling, then it's not ready for you yet.
It's too fired up.
Yeah. Then you got to back off, get a cold pack on there. And also, I will do some quadricep stretching to, if the quads are tight.
Yeah. So, I mean, basically, you can, if I'm stretching this quad, you can grab right here and stretch the quad like that.
Right.
So, there's other ways to do it. But
right.
I actually would try the cross fiber on an athlete before the event even.
Sure.
I mean, I'd say, because if you can, that's really going to maximally stretch it out and loosen it up before the event.
Sure.
So maybe it's going to be less likely to tear again. So I would try that. And again, same guidelines. If you can do it for a while and it starts to feel a little bit better, fantastic. If it starts to just hurt, you got to back off. And then you probably shouldn't be jumping then.
Yeah.
Unfortunately. But
try and tell someone
Yeah,
at that
tell
level.
an athlete, I know.
So then
Exactly.
you're going to, tape it or,
Right.
use the strap like this.
With the tape, I don't know that we're even going to show that today, but I've seen it where people just kind of roll up the tape even and put it around and tape it around.
Right.
Kind of doing the same thing, just using tape.
Right. Yeah.
So-
Using a specific tape, athletic tape.
It's got to be
you
a
could use it.
non-stretch tape. It's got to
Right.
be like an athletic tape that,
Sure.
that is non-stretch.
Right. To get that same relief on that tendon.
So,
So, Bob, it's a tough situation.
it is.
When you really want to get after and do your
Those
event.
overuse injuries,
Yeah.
like shin splints and those, it's just so frustrating because you trained all year long and you're ready for your event
Right.
and you can't do it well because you're hindered.
But I'm telling
So-
you, this young lady, she is tougher than nails. She's in ROTC as well.
Oh,
And
she
she gets
is.
up 4:30 in the morning to go running before school. I mean, you're not going to slow this girl down. I think she's going to do well. She'll probably go to nationals, and we're looking for
All right, we'll
first
be looking
place.
for her name. All right.
Good luck, Jerica.